Hello, my name is Jung Eun Oh. I am a general dentist working in the field of global health at the JWLEECENTER for Global Medicine in Seoul, South Korea. My poster presentation is titled An Updated Overview on the Association of Individual Level Socioeconomic Status and Periodontal Disease, a Scoping Review. The content is as follows. The main findings. Out of a total of 953 publications, 26 were included for review. Of these, 22 were cross-sectional studies, 3 were prospective, and 1 systematic review from 2005. 3 articles measured and mentioned inflammatory biomarkers, specifically the C-reactive protein. Of 26, 6 publications, approximately 23%, were from low-middle income countries. 24 of the papers showed that individual socioeconomic status has an association with periodontal disease. Introduction. Periodontal disease has been shown to be linked with socioeconomic factors. In addition, there is an increasing interest in its relation to systematic diseases. However, there is a need for an updated review to understand the specific association and pathways. It is important to note the diversity of microorganisms in the oral cavity, even compared to the entire human body. The formation of the acquired pellicle and biofilm is a dynamic process with various factors that affect it. The microorganisms present in each stage are also important to note. The etiology of periodontal disease is multifactorial, and we aim to review the role of socioeconomic status in its development as shown in diverse studies. It is also important to note the increasing global burden of periodontal disease, increasingly in low and middle income countries. Methods. For the search, publications from 2005 to the present date were included, utilizing the key terms periodontal disease and socioeconomic status. Only original full-text publications were included. The studies had to have an objective clinical method of evaluating periodontal status, such as clinical attachment levels, recession, bone loss, and the studies also had to assess the individual socioeconomic status through a questionnaire. Major databases such as PubMed, Google Scholar, Cochrane, and EBSCO were utilized. 26 publications were included for the final review. Results. The following table demonstrates all the studies that were included for the review. As you can observe, only 2 studies, both of which were prospective studies, found that socioeconomic status was not significantly associated with periodontal disease. It is important to note that nearly half of the studies were from high-income countries, such as Sweden, Germany, and the United States. Less than a quarter were from low-middle-income countries. Upon closer inspection, interestingly, South America, specifically Brazil, had many studies conducted regarding the topic. As mentioned before, the majority, 92.3% of the studies, found a statistically significant inverse association between socioeconomic status and periodontal disease. Increasingly, studies that focus on the inflammatory nature of periodontal diseases are being conducted. 3 studies from the review included inflammatory biomarkers, specifically of the C-reactive protein, which was present in cases of periodontal disease. Conclusion. Since 2005, there has been increasing evidence showing the inverse association between socioeconomic status and periodontal disease. While a majority of studies included showed an association between socioeconomic status and periodontal disease, these were all cross-sectional studies. Thus, there is a need for cohort studies or quasi-experimental studies regarding this topic to infer causality. In addition, the mechanisms of socioeconomic status and the specific pathogenesis of periodontal disease remains unclear. More studies are needed to shine light on this topic. Lastly, studies that focus on adolescents and that originate from low and middle income countries are also needed to further understand the association of socioeconomic status and periodontal disease. Thank you for your attention, and don't hesitate in contacting me for more information. Thank you.